Good evening, everybody. Can you hear me?
Yes.
Okay. I lost my MacBook today, so I'm on my phone. Um, and when I get off this meeting, I'm gonna find my MacBook. Okay. One, two, three, four. Let's wait for a few more minutes. See if anybody else. We're missing. I believe Dewan, and I don't know who else we're missing. Ann is here. Jesse is here. Jan is here. Oh, and we're missing Brian. Can anybody text those two people?
Broderick is also missing, and I
I
spoke to him
can.
this afternoon. I don't think he's going to be able to make tonight's meeting.
No worries. I don't think he communicated that, but that's fine. No worries. Okay. Still missing a few council people. That's my time. Okay, well, we got to do what we do. Yeah, I know I like to be punctual. And it's already 5 minutes after the hour. Um, Keenan, can we go live, please?
Yes, we are recording.
Okay. Good evening and welcome to the March 25th meeting of the Community Service Committee of the City Council for the City of Norwalk. With me, I have Councilperson Ann Witherstream, Councilperson Jan Devonshire, Councilperson Jesse Bacalo, and then we do have some special guests. As other members of the council join, we will acknowledge them at this time. We will now, I call for a motion of the acceptance of the January 21st meeting.
I have a motion to for approval with one minor correction. It was
Okay.
Councilman Degenshine, not Councilman Dellinger, who abstained. That's really minor, but
No, it's important because those are two different people.
yeah,
Correction is noted. Any other corrections? Okay. All in favor, raise your hand. My hand is raised. Any opposition? It is carried. We have Councilperson Dewan Wiggins that has joined after the roll call at 7:07. We will now have public participation. If there's anybody that's in the public that wishes to speak, we ask that you raise your virtual hand so we can unmute you. Please, as you are addressing us, please only talk about those things that are outlined in our agenda that has been posted. And you have 3 minutes to speak. State your name and your address. Are there any people for public participation? Okay. Do I see any hands? Okay. Seeing no hands, we will be closing public participation at this time. We do not have any new business that has been stated on our agenda. And so we will go to our action items. Um, Action item A, authorize the mayor, Barbara C. Smith, to execute any and all agreements and amendments with Education Development Center, Inc. to process payments for the online training tentatively scheduled March 2026. Ms. McMahon?
Yes,
Can you speak
Chair
to this
Ayers.
item? Can you speak to this item?
Certainly. The request is in relation to a contract for funding for the Carver Foundation. And we have Navalette Peterkin with us today to answer any questions in regards to the matter before the council.
Sorry to interrupt, but isn't that item C? Are we on item A right now?
Your item on A. It's about the payment purchasing.
Keenan, would you like me to speak to that? That's a health department item.
Yes, we'll have Teresa Argandesi speak to that first item A.
Great, thank you. Hi, everybody. Thanks for giving me the time to speak about this. This is actually we have grant funding to train some of our health department staff as well as several of our community partners on various mental health topics and suicide prevention topics. This is one of those. We've worked with EDC in the past on some other wonderful activities. But as part of their estimate and billing process, they have rather lengthy terms and conditions. And so when speaking with Corporation Counsel, they acknowledged that this would be something the mayor would need to sign off on, and we bring it to you all. It is really just to accept their estimate for the cost, which is relatively low, and then also pay for the training for health department staff as well as several community partners. The action item says it was tentatively scheduled for March 2026. We will be looking at more of the summer date for this training, but have had wonderful experience with this organization and happy to answer any questions folks have. Yes.
Thank you. Thank you for that introduction. So is this a new training program, or is this a continuation of training that's already in process?
This is a training that EDC has done in the past and does on a regular basis. It will be a new offering to our partners in Norwalk, as far as I know. But it does tie in really well with some of the other trainings that we have offered.
Thank you.
Sure.
Yes. You're muted, Nikki.
I apologize. Any other questions?
Just
Councilperson,
a
go ahead.
little bit more eye dotting. The estimate that I see from EDC shows the start date of 3/16/2026, which we've just mentioned. It shows an end date preceding that of February 16th, 2026. So if that needs correction just for legal purposes, we probably should do that. If not, I'm sure it will appear somewhere else in the contract document.
I think before, because our meetings have been moved, when the health department originally reached out to me, that's why the backup says those dates, but they were in the process of moving the dates around to be appropriate for this meeting. So they do know that they do have to move those dates around. We just hadn't done it because we have moved this community service meeting. But I do not think that legally that will hold us up with this particular contract because we're only getting an estimate. We're not dispensing money. Any other questions? Seeing and hearing none, all in favor, raise your hand. Councilman Wiggins? Any abstentions? Oh,
No,
Councilman Wiggins?
abstain.
Okay. It looks like it is unanimously carried. Thank you. The next item is item number B. Authorize the Mayor Barbara C. Smith to execute any and all agreements, documents, instruments, or amendments as may be necessary with Carver Foundation, Inc. to provide financial assistance for the 2026 Summer Enrichment Program in the amount of $147,000 account noted. I do see Navalette with us tonight. Navalette?
Can you hear me?
Now I can hear you.
Echoing. Oh my God. Oh my God. How can you fix the echoing?
I do not know how to fix the echo.
You may be on two devices at once. So one is picking up the other.
I'm only on one device.
Or if you have headphones by any chance?
I can get.
This is like psychedelic.
I was
I
gonna say
tell ya.
it's pretty cool sounding, so
Novelette, we will come back to you so you can fix whatever technical
Okay.
issues you were having.
Chair
But that was
Ayers.
like a
Okay.
fun house. Yes, I heard my name.
Excuse me, I didn't mean to interrupt you, chairs. I think Ms. Peterkin was listed twice, so
Okay.
she's listed as a panelist. I've removed her from the attendees, so if we can give
Okay.
it another try.
Novelette, can you speak now?
Yep, I can.
We
Thank you.
fixed it. Eureka!
Thank
Okay,
you.
here we go.
Thank you. Thank you for having me. So the funding that we're seeking is to support the two affordable enrichment camps, one run at Carver and one that's run at the South Norwalk School. Formerly it was 3 camps. When we took over the South Norwalk camp, we combined the 2 into 1. The programs, the 2 camps are the most affordable in the city, and this funding help us to make that happen. The camp supports 150 students each, one at the Carver and one at the South Norwalk School. Due to construction this year, both camps will be run independently at the Ruby Shaw Elementary in South Norwalk. The program offers students an opportunity to have a robust experience. They get we have 2 literacy teacher, math teacher, science teacher. So there's project-based embedded in the program. The kids get to go on trips, 1 trip every week, and swimming. All that is included, and the price for the camp, the highest a family would pay is $700 for 6 weeks. And that is the highest that somebody would pay based on their income. And so it's we have a sliding scale for that program. We have operated the program for as long as I've been at Carver, 21 years. I'm sure Nicole is aware of the other camp that we took over. We've been supporting our facilitating that camp close to 10 years. So any questions, I am willing to answer. Can't hear you. You're muted.
I was saying just such great things about you, Novelette. Councilperson Jesse Buckalow.
Thank you, Chair. And thank you, Novelette, for joining us. I know how important summer enrichment is for our students' development, and it's exciting to hear about how affordable it is for our families. And, Carver does an amazing job in serving our children, youth, and families here in Norwalk. So thank you for all the work that you do, as well as your staff and the programming over the last 20 years, which is impressive. So appreciate all the information you shared. Just wondering if you can, is this money going directly to offsetting the costs of the program for the families? That's like the part 1, and the part 2. If you could just share kind of what is the total cost of all the program? If I understand right, it's 300 students across 2 schools.
Yes.
Correct? Cool.
So the program at Carver costs $193,558, and the one at Sono costs $192,933. And so the 147 is divided. 80,000 goes to one, and the rest goes to the other. And that goes to offset the costs. So when we took over the program, there was $90,000 that the South Norwalk program was getting. So what I did over the years is I used that as leverage to be able to expand. So the program didn't have what we have now, because we took it over, wanted to mirror what we were doing at Carver. And so we went out and we tried to raise money on top of the fees to make sure that we could keep the program affordable. Last year, the city cut 25% And next year, I think they're planning to cut again. But if they do, then we have to reconsider whether or not we are able to offer that, because already I'm going out to raise $239,000 for both camps. Sometimes we're successful, sometimes we're not. So, so it's hard. If the city wants us to continue to provide an affordable option, then the city has to help us with that.
Absolutely. Just appreciate all that. That's super helpful. And then the rest of the funding, is it mostly private and philanthropy? Is there any state funding for summer enrichment or anything like that?
We got, when there was art money, we got $50,000 for each one, but that's gone away. So it's all fees, the fees that we collect, and then it's private funding. I have to go out and raise the rest.
Got it. Thank you so much. Well, I'm glad we're able to support you this year, and we'll figure out next year if that's the case. It's a new council, new mayor, so who knows?
Yep. Okay.
And I just, Councilperson Witherspoon, I see you. I just want to echo that. So I used to run those camps before Carver took them over under Neon, and Novelette has expanded the offerings, as she said, of camps. And I just wanted to give some information for the city and my colleagues. So I run programming now in Stanford for Roscoe, and we are the cheapest camp, and our camp is $1,550 compared to what Novelette is saying. And we are the cheapest camp in Stanford. And so cost value, we need to just put it in the back of the head and note what the value that our young people are getting, and the fact that Carver students, and this is documented, and Novelette can help me if I'm wrong, she documents to make sure that there's not that summer slide. And that is well documented.
Oh yeah, we can show that we help Norwalk become the #1 urban school district, because we help low achieving student grow faster. And our summer programs, we have a data analyst that's stationed at the district. It's embedded with the data team, and we can show how the students grow as a result of their participation. We have 2 literacy teachers that are dedicated to 2 for each camp, that's dedicated to reading, and we have math. So the kids spend hours per week on reading, hours per week on math, and they do a lot of project based around science and arts and so forth. I encourage you to come and pop in and see us in action.
Councilperson Ann Witherstrand.
Thank you. I just wanted to, I have one small question. I'm just curious how your costs have gone up. If you've noticed, like where your costs to run these programs have gone up, and where are you seeing like kind of extra need that we can keep in mind for you?
So transportation, when we go on field trips, transportation. So we actually get the same rate as the district. So as the district price go up, so does ours. So we've been notified that the price is going to go up on the transportation side. Insurance price goes. So we have to insure every camp, and the insurance on the camp is gone up.
I was wondering about that.
Yes. Yeah. So we do participate in the free lunch program. So there's no food cost to us in that sense. And then the programming that we provide. So we, to bring in to go to the maritime or bring in the maritime educators, that's cost money, And so, there's increases that we've seen. I mean, since last year, it's gone up since last year, and we anticipate again next year it'll go up again.
Yeah. Thank you for that context. I was just thinking, I mean, it's incredible what you've done with this program, with the budget that you have, and I'm certainly dedicated to making sure that we can keep funding this and protecting. This is worth every penny. Very, very important.
And
work that you're doing.
So it's important for you to know this. So the program that we run, the reason why we do a program in South Norwalk is because the city wanted to make sure that parents had an option where they can walk as opposed to trying to take the transportation. Yeah. And so that's, and we've operated at the former Columbus Magnet, and now we're moving to the new school as they move to a new school. So the South Norwalk program is very important for the families there. I mean, the option that they have. And then we, it's 8:30 to 3:30, but there's a 3:30 to 5:30 option for families who can't get there at 3:30 at a minimal cost. I think it's $25 or something like that. We do.
Yeah, no, it's so important.
And even though, just to add on, it is based in South Norwalk, and I think the majority of the kids do come from South Norwalk, it is open to residents throughout the city.
Oh,
It's not,
absolutely.
it's open to all. Just
So
want to say.
the registration is on our website, and families can pick which site they want to go to, because they both designed as the affordable options for the residents of Norwalk.
Council,
We don't actually advertise because year after year we have a wait list, and
Yeah.
Thanks to Norwalk Public Schools, we're able to add a third enrichment camp when they reduce the summer academy or summer school, the grades. Remember, they dropped the grades. We saw a waiting list of almost 100 kids, and I went to the superintendent. I said, "Listen, these are the kids that you won't have in the summer. We got to do something." And the city, and they did put in $79,000 something dollars, and we were able to add a third site, which is at Jefferson Magnet, and we have 200 students there. And it's the same 10 to 13. It's just that the district helped fund that one.
Councilperson Jan Dingenheim.
Thank you, Chair. I want to redouble anything that was said before about the value of your program. It is extraordinary, and the results are there to see. So you do have support at this end. I just had one question so that we can be as effective as we possibly can acting as your advocate. You mentioned that there was grant money that you no longer have. From whom did that grant come, and is there a way that we can press for its reinstatement?
So we were getting money that was from the ARPA, so COVID. So that was passed on to the state. So as a licensed camp, they gave us we applied for a grant we applied for is a 2-year grant, $50,000 for each site, but that's gone away. There's no more. But last year, the city reduced the funding to us by 25%. And I've been notified that could possibly happen next year. And I'm saying is if it happens, then, one of the camps is not going to happen. With the money we're getting, we're not going to be able to operate too, because it's already a stretch for the funding that we got to raise, not only for two affordable camps, but there's actually 3. But the school district supports that one. So the city supports 2, and then the NPS supports the other one.
Thank you. I'm in your corner.
Thank you.
Councilperson Jesse Bucklow.
Thank you, Chair. Last question just prompted me. Does the school sites that you're using during this, I think I know the answer, but it'd just be helpful to hear again. Are you using the school buildings? Are you paying a fee to use those buildings?
No.
Okay.
No.
So that's in kind.
We partner with the district. We have a program in every school during the school year, and then we run multiple summer. We run all the summer transitions at the middle school, summer transition at the high school, and we provide the support for the kids who go to summer school. We provide enrichment for those students, and then we've added an enrichment because of the demand, which the district supports, and then we have the 2 other. But the city only supports the 2 long-standing camps. That's why we're here. But we have over 1,500 kids in summer programs throughout the city.
Yeah, I just think it's helpful for the council members to know that some of that is in kind to do the best we can to support that. So that's helpful to know. Thank you.
So the district the programs, I look at those programs as a program of the district. So not only do we get use of the facility, we get unprecedented access to the resources, because those are the students. The transition programs are for 5th graders who are going to transition to the 6th grade. So they spend 8:30 to 3:30 in the middle school they're going to transition to, with the 6th grade teachers they're going to have. And so those teachers are the ones who are leading the program. Certified teachers are leading the program. So and they're the staff from that school. So there's no need to limit access to the resources. So if that helps. I just find that that's the best way to operate as a partner versus a vendor. I partner with school district. I'm not a vendor. We don't do the vendor stuff. So you know that.
Any other questions? Hearing and seeing none, all in favor, please raise your hand. Any opposition? And it passes unanimously. Thank you, Navalette.
Thank you. Take care.
Okay, take care too. Item C, authorize the mayor, Barbara C. Smith, to execute any and all agreements, documents, instruments, or amendments as may be necessary with the local prevention council in the amount of $20,000, account noted, to the fiduciary Positive Directions, 90 Post Road, Westport, Connecticut, 06880, care of the Norwalk Partnership. Who will be speaking to this?
Chair, we
I
have
see Margaret somewhere.
Margaret Watt from Positive Directions tonight.
Welcome.
Thank you. Good evening, everybody. Margaret Watt, I'm the Prevention Director at Positive Directions, the Center for Prevention and Counseling. We're a local nonprofit. We are fortunate to be able to serve as the fiduciary for the local prevention coalition for Norwalk, which is called the Norwalk Partnership, aka TNP. Most of you are very familiar with TNP. Mr. Degenshine, I don't think I've had the pleasure of making your acquaintance before. So if the others will give me a second, I'll just kind of explain what the Norwalk Partnership is. And I'm just really happy to be able to talk about this and very grateful to the city for helping to support work that is really fully coalition work. So much volunteer time goes into it, and we really have tremendous results from it. So the Norwalk Partnership is a citywide coalition of last year. We had 132 volunteers and 66 organizations collaborating from across 12 required sectors, working together with the common mission to prevent substance misuse and promote mental wellness in Norwalk youth and young adults. The work is all evidence-based, following the National Public Health Model for Prevention, which means it's multi-sectoral and it's data-driven. One of the big things that the Norwalk Partnership does that brings tremendous resources and collaboration to the city of Norwalk is our biannual Norwalk Youth Survey. The last one took place in the fall of 2024, and the next one should be coming up this coming fall. So we'll be building a relationship with the new superintendent. We survey about 4,000 students in grades 7 through 12 every 2 years, and the survey data is valuable to everyone. We gather information on student lifestyles, protective factors, risk factors, their use of how they're using their time, like are they engaged in clubs and sports, their mental health, their substance use, their perspectives on technology. And that information alone, even if we did nothing else, the schools have used it to embed new resources and develop programs and get grants. The nonprofit community has gotten grants, created new initiatives. We have leveraged that to get more funding for our prevention work in the community, to bring in funding to continue that work. For example, with the recently concluded priority planning process that some of you were involved in, to really go very big picture and develop a vision for youth mental well-being in Norwalk and say, what can we all do together? That's just a tremendous asset from the Norwalk Partnership. In addition to that, as I think most of you know, we work across informational, educational, and environmental strategies. So we provide skills development. We offer supports for youth and families. We have clubs in both high schools. We give youth a voice. We run teen nights out. We do work on policies and in the schools, implementing, working to create more equitable and restorative policies for youth, for example, who are caught vaping in the bathrooms. We've done legislative work at the state level and changed laws, like really tried to address things like the smoke shops and cannabis that's being sold illicitly. In this last year, one of the things that we did was we trained all Norwalk Public Schools faculty in middle school and high school faculty in suicide prevention, because we see in our data how prevalent suicidal ideation is, and we want every single adult to be able to recognize signs and respond. And we also provided cannabis professional development to every health teacher, gym teacher, and social worker in the middle schools and high schools, actually, and even elementary school health teachers. So the contribution from Norwalk, the $20,000 that you'll be voting on tonight, is just part of braided funding. I want you to know that the total funding for all this prevention work at the moment is $159,000 a year. That's including the 20,000, which was reinstated by Chief Daniels 2 years ago, as per the document that you saw. I actually want to stop myself and say the document you received with the agenda for tonight, that's the sort of background document. 2 years ago, Chief Daniels at the time wanted to revive the prior city commitment to prevention in the city of Norwalk. And so at that time, the document was produced sort of explaining what a prevention coalition is, what it does. I've just been giving you some examples and saying, as a city, don't we want to contribute to this? Apart from the 20,000 from the city, which this would now be the third year, the state funds prevention in Norwalk at a level of $14,000 a year total, expected to address substance use and also the substance use in youth, and also the opioid epidemic generally. And so the bulk of the work that I've been describing is funded through a federal grant that I have from the Centers for Disease Control, which is called the Drug-Free Communities Grant. I do want to highlight that grant is in year 7 now, coming to the end of year 7. It will not be funded past year 10. So I already want to plant the seed to the city that's 125,000 out of the 159 that we have now to do all the stuff that I'm talking about. We have never received an increase from the state ever. So that's not going to change. Things that have been funded through this council, through your predecessors on this committee, funded the Teen Nights Out initiative a few years ago, right? That came out of our survey data. It came out of our committee work. We had a lot of parents and professionals saying kids need fun, sober, social events to do on a Friday night when they're in high school so they don't get into trouble. This committee gave us a grant of $50,000. That was a one-time grant. We made it last until this fall. We funded 20 events that were open to any high schooler in the city. They had mini golf, ice skating, etc. Since after September, when we ran out of money, we haven't had any. We have the next one coming up this Friday night. I am getting, I'm just borrowing and stealing money from wherever I can get it. So I'm funding a couple of teen nights out this time around with a $5,000 grant from the state for our Smart Recovery Teens groups, which we just reinstated, again, to serve the needs of the kids. So what I'm really saying is I feel like we do a lot. Most of it involves so much of it involves outreach, relationship building, coordination. And if we had tripled the total money that I told you, we would still not have enough to do what we want to do for kids. I think we all know that. And we just heard Novelette, right? Like there are so many needs, but I would say that what's important for you all to understand is that every dollar is well spent. The 20,000 from the city goes to no staff. It does not go to that. We have used it in the past year and we'll use it next year for extra data analysis from the survey, because we are now limited by the federal government in exactly what we can and can't look at in our youth data. If you've seen the bus shelter ads around town raising awareness about marijuana, that was funded by you all last year. We ran a summer program. We provide food to the teens in the clubs when we have 2 meetings a week all year long. It helps to fund the big Norwalk for Mental Health event coming up in a month. It funds communications, some social media, some ad buys, some of the training and curriculum work. And so, I think that we're really grateful for the $20,000 commitment, in particular because it doesn't come the way state money comes, where it's like you can only use it for vaping in 8th grade, right? You're allowing us to fill gaps that we see, to meet needs that we see. It's all in the same guise of prevention at the community level. And I hope I've sort of given you a lot to think about, in the sense that the 20,000 is invaluable. We need it. And the 125,000 a year is not going to be here that many more years. So please start thinking about that. I am open to questions.
Anyone have a question? And before I acknowledge the questions, I do want to state that Councilperson Broderick Sawyer joined us at 7:38. Okay, I think I saw Councilperson Jesse Buccalow hand raised first. Jesse?
Thank you, Chair. I don't have a question. I just want to, echo that the Norwalk Partnership is an incredible asset for our community, and they do a lot that Margaret just walked through, and really appreciate everything you do, Margaret, for the community. There are so many different pieces to the work they approach, and it's all in collaboration with partners, and working together to meet the mental health challenges that are very high, that our youth are experiencing right now. And I just want to talk about one specific piece, the Norwalk Youth Survey that they administer that has gone through Norwalk Public Schools every other year is a key asset of data that the community really uses to inform how our children, youth are struggling, and where things have improved. And it's a really important data point that we need to continue to have and inform our decision making. And it's a huge piece of their work. And so I want to highlight that as a key part to everything else. But this is, I think, a really great use of funding, and I'm in full support of it.
Thank you, Councilperson Witherstrand.
I have to unmute myself. I just want to essentially say very similar sentiments, and thank you, Margaret, for your leadership and how you are so clearly articulate the need and describe this sort of, complex braided approach to to bringing in funding and what you're able to do with that. It's just really impressive, and a reflection of the passion that's clearly. I was so happy to be able to participate in the community, the planning process with the partnership this year, because it was so awesome to see how that data that's collected translated into strategies and initiatives and goals. And now, we have things in place, and we need to just keep finding the funding and finding the partners to help us provide the services. So
Thank you.
thank you very much for your leadership.
Thank you. Can I just add, sorry, Ms. Ayers, if you don't mind, I just want to add, because of the mentions of the survey data, if anyone wants to look at it, please check out the norwalkpartnership.org, because we do have a website with lots of resources. The survey data is on the resources page. The infographics are buried throughout the different pages. And I'm available for questions from anyone at any point after this.
Any questions, comments, or concerns? Seeing and hearing none, I will call for the vote. All in favor, raise your hand. Any opposition? It is carried unanimously. Thank you and congratulations.
Thank you so much. Have a good evening.
Councilman Ayers, you're on mute.
And I was just talking. I apologize. Okay, thank you for that. Next, we will have discussions. Discussion A is update from our Human Service Director, Ms. Keenan McMahon, on the Norwalk Opiates Settlement Mini Grant Program, and informational only. There is no action on this item. Ms. McMahon?
Thank you, Chair. And I'll be brief. Just wanted to provide the committee an update. We currently have the Norwalk Opioid Settlement Mini Grant Program that's been open. We've received several applications. We continue to receive additional applications, some of which are under review. There's no deadline with the program, so it's on a rolling basis. but I am pleased to let the committee know that we have, of the applications that we've received and reviewed so far, we are able to notify and award three community partners that they will each be receiving a $10,000 grant from the program. Those programs being Liberations Programs, Triangle Community Center, and the Norwalk Community Health Center. And we anticipate being able to award more grants as we get additional applications.
Okay, thank you. Any questions from the council? Okay, I don't see any questions. Okay, so we're just gonna move on to the last agenda item, which is B, the introduction to community service panel on the service for Norwalk children and youth by Human Service Director, Ms. McMahon. And our panel tonight includes our Director of Youth Service, David W. I'm going to kill your name, so I'm not going to disrespect you and try to say it. The very infamous Mary Oster for early childhood, our early childhood coordinator, and Teresa, who's the Assistant Director of Health and Community Health. And I just want to preference this conversation in saying when the city council came together for their retreat, one thing that was echoed was youth. Addressing the needs, understanding the needs, and making sure we're doing the best for the youth of the city. And so I just so happen to be fortunate enough to chair the committee that directly deals with multiple youth programming and nonprofits that deal with youth outside of the school system. So we just want to have an open and transparent conversation. We would ask each of you just to give a brief description of what you do for those new council people who may not be aware of what your department does, and specifically what your department does for youth. This is what our conversation is going to be about. And I think myself and my colleagues have kind of agreed that this meeting, including 3 meetings, will be centered around youth. We're starting with what the city provides for youth, but we will be expanding that conversation outward as our months go by. So, Ms. McMahon.
Thank you, Chair, and you've put everything succinctly. So I'm happy that we were able, through the Community Service Department, provide a panel tonight of several of our staff members who do provide services that directly impact the youth and children of Norwalk. And so I will start off with our Youth Services Director, Dave Valensik. And each person will just briefly describe their services and then any questions that the committee may have. Thank you.
Just for edification, my last name is pronounced just like it's spelled. It's Walenchek. Anyway, I know it's a tough one, Nicole. No problem.
I wasn't going to be disrespectful, so that's a W.
It's a tough one. Yeah, let me just give you a brief overview. And I just want to say for, again, some of the members here who may not be aware, the Youth Services Department embedded within the city functions as the Youth Service Bureau for the city of Norwalk. We are part of a larger organization, Connecticut Youth Services Association. There's 100+ youth service bureaus around the state. We were established by a state statute back in 1972, youth service bureaus. I can at some point provide you additional information about that if you want it, but just to cover, there are similarities amongst different youth service bureaus around the state, and there's also differences. Some are very small, some are larger. We unfortunately have a broad range of the types of things we can do, but we can't do everything, obviously. One of some of the focal points of our Youth Service Bureau is we provide care coordination. What is that? We get referrals from the community, from the schools, from the police, from our youth diversion team, and it's youth who may be deemed to have behavioral health issues or possibly in need of other services. They're assigned to a care coordinator within a department, a behavioral health assessment done. Those are done by master's level mental health clinicians. And then those individuals are connected up with a service provider in the community. And followed to make sure that the connection happens, that they don't fall through the gaps. They're also connected with ancillary services, perhaps a sports camp, a mentoring program. If when the family comes in, it's deemed that they might have food insecurity or housing issues, they'd also be connected with the Human Services Department's Community Resource Hub for assistance in those issues. And then those families are tracked over a 6-month period. We do check-ins. We work with them to make sure that they're getting the services they need or additional services. We also operate, some of you might be familiar with the term JRB or Juvenile Review Board. The state has sort of updated the nomenclature on that. They're now called youth diversion teams. We're not using the JRB language anymore. So those are youth who come into contact either through a juvenile arrest in the community or an arrestable offense. Sometimes there's an offense that they could be arrested for, but it's not actually executed, and they're diverted to the youth diversion team instead. That's a panel made up of a variety of community members. Usually there's a mental health professional, somebody from juvenile probation, members of our staff. They have an assessment with the family and the youth initially. Then there's a hearing. And the goal is not to be punitive. We follow restorative justice model. The goal is to try to implement a plan for the youth that hopefully is going to be rehabilitative, for them to take responsibility for whatever the offense was, and to hopefully help them avoid future involvement in the juvenile justice system. And again, those cases are tracked over a 6-month period. I should also mention, as a part of that, we contract for some specialty mentoring services for some of those youth. We use an organization called Daniel's Youth Leadership Program. It's specialized one-on-one mentoring with a professional. He meets with, not every YDT kid gets that, but the ones who are referred, he meets with them every week, spends 1 to 2 hours with them a week. It might be helping them with homework or other endeavors to help keep them on track. Also part of the youth diversion team program is we have a part-time individual who does victim assistance services. So perhaps there's restitution due to a family as a result of an altercation. I can think of one instance where there was a fight and one of the kids who was a victim, his glasses were broken. So the victim services assistant helped the victim recover the cost of having their glasses replaced. Moving along here, what else? Oh, we also have our peer connection program we do. That is a program that is geared towards middle school students. It's open to any middle school student in Norwalk. It's a youth development program. It's activity-based. They do it in the evenings, either at City Hall or out in the community, depending on what the program is. They might do things like have a cook come in and teach the kids how to make a basic meal like a pizza. They've had Animal Embassy comes in that teaches kids about conservation and being community minded, and they bring animals in, the kids get to interact with. There's a whole curriculum that they do throughout the school year. We also help, it's facilitated by Darlene Young, but we also support the summer youth employment program that Darlene really heads up, but some of our staff also assist in facilitating. That program is gearing up now. The applications for those positions are open through the end of the month, and then they'll be doing interviewing, training, and placements for the summer. That program's been around, I don't know how many years, at least 20 years, probably longer. Those are the services that we provide. We do get some grant funding from the state. We get probably all in about $125,000 a year in grant funding. Some of those grant funds subsidize the operations of the department. Some are directly program related. For instance, our part-time victim services assistant is funded entirely through the grant. The Peer Connection program is entirely funded through a grant. We have a youth we've hired to help manage our webpage. We pay him through our grant. That's sort of a broad overview. We also participate in all sorts of community collaboratives, NOROC Acts, TMP that Margaret just spoke to, Region 1, YSB collaboratives, statewide collaboratives. I won't mention all of them, but that's a function of what we do as Youth Service Bureau.
Thank you, Dave. And we'll have Mary Oster speak next. She's our early childhood coordinator.
Hi, everybody. I do have a real short PowerPoint. Can I show it?
You should be able to share on your screen.
Okay, great, thanks. If I don't somehow not do it right. Oh, golly, can you see it? There we go. Okay. Thank you so much for this opportunity. I'd love to talk about the work that we do here in Norwalk in early childhood because it's really important. Supporting families from the very first is important. We always say that kids don't really come with an owner's manual, and it's a scary time for families. It's a time when they really do need a lot of community support. So I just want to tell you a little bit about what we do for our very youngest citizens. So this position was started as a grant-funded position in 2011. I have been the only early childhood coordinator since that started. I'm a department of one with a lot of support from our Community Resources Hub and from my colleague on the Board of Ed side. So we have a really strong local early childhood partnership in Norwalk. And it used to be called the Norwalk Early Childhood Council, which some of you have probably heard of. It's now called the Local Governance Partnership, a little bit of an unwieldy title, but it has to do with some changes in state funding that the state put forth. And so we have made some changes there, but it's still really a very collaborative, inclusive community table. So I serve as a resource for families prenatally through kindergarten transition. I get a number of calls a week from families who are looking for childcare, have questions, don't know what to do about registering for kindergarten. I mean, the list is pretty long. And you know, it's hard for if people don't really have a good support system, or they don't have family here that they can talk to about what happened with their kids. Sometimes it's really difficult for people to know where to go. And so I'm really privileged that I can help them and be kind of a first point of contact for them with the city. Our office is, or my office, I share an office with Carol Carazelli, who is the Early Start coordinator, who works with all of the funded programs in Norwalk. And we're at the Norwalk Public Schools Family Center, which is over at 1 Park Street. It just makes sense to be co-located with the Board of Education because I work so closely with Carol. And she is kind of on her own too, so we work very collaboratively on a lot of different things, and really mainly supporting our early care and education programs. So we provide support and resources for the early childhood community, including professional development, classroom monitoring. We go in and do monitoring for quality, coaching of teachers if they need coaching support. We have a lot of staff that Early childhood is a kind of a low paying field, unfortunately, and so there's a lot of staff turnover. So we really try and be as supportive as we can, and help our programs, help the teachers to build knowledge so that they're better able to serve the children and families in their programs.
Mary, excuse me for 1 second for interrupting. I don't know if you've shared the slides yet, or if
I did.
they're not appearing on the screen.
Oh
So
no, I am
if you
so
want to
sorry.
send them to me, I can share them also
Okay,
as you continue.
oh, I am so sorry. I'm chatting away and okay. Yeah, it doesn't look like it. It's telling me it's not going to load. Okay, I apologize. I did not know that. Okay. I was hoping you were seeing. Yeah, Keenan, I can't get it to share.
Okay. If
All
you're
right.
able,
Yeah, I'm almost done.
continue.
So okay, um so the kind of the early childhood landscape in Norwalk, all of our early care and education is provided by center-based, licensed center-based programs and licensed family child care programs. And so they all are small businesses. And I think that's really important to remember. They're all small businesses here in Norwalk who have employees who pay taxes and who are really serving the children and families in our community. Some of those programs do receive some state funding and some do not. Carol and I really I work with all the programs, but I really help also with the state funded programs. We also have federally funded programs. That's the Greater Norwalk Head Start program that's located in 2 city buildings at Ben Franklin and Ely School. That's a free program to children who qualify, and they serve about 150 kids. The Early Start CT program is the state funded, which funds infant, toddler, and preschool slots in Norwalk. Those spots are those are sliding fee income depending on the family, or sliding fee tuition depending on the family's income. And between the community programs and a few Norwalk Public Schools classrooms that are also Early Start CT, that serves about 1,000 children. And then we do have center-based community programs that do not receive any funding. And we support families in a number of different ways. We know it's really critical to be as supportive as possible and to help families find services, and things and just to help them. Sometimes parents they don't know about brain development. So what can we do to really help them understand their kids better? Sometimes it's really difficult for families. They have so many things going on. Um, so in Norwalk, we are so fortunate to have a really robust community of services for children and families. And I have to say that we all work together, very collaborative. When I talk to people around the state, they usually say, "Oh, Norwalk, yeah, we know about you," because they hear so many good things about what we do here in Norwalk and how collaborative we are. Um, so we do have home visiting programs for families. That is mainly done by Family and Children's Agency, and they go out and visit families and really help them understand their children's development and really support those families. We have an ASQ project that is a community program that's done in childcare programs, home visiting. It's done at kindergarten registration. It's a developmental screening, and we've been doing that for 10 years. So we have a really wonderful history and data for 10 years to support so that we know how our kids are doing, and that's really important. And it's also leading up to kindergarten, and then how they've done after kindergarten as they've progressed through the grades at Norwalk Public Schools. We support families prenatally with our community providers, including the Norwalk Community Health Center. The WIC program, Women, Infants, and Children, serves low-income women, and that's through the Norwalk Health Department. The Norwalk Community Health Center has free diapers that families can access 2 days a week. We have playgroups and parent cafes for families. That's where families can come together, kind of have a facilitated playgroup. The parent cafes have speakers and discussion. That's actually held down at the New South Norwalk School. And those are run by our partners at Norwalk Acts and our community advocates. And the Norwalk community advocates are all women. We're parents, our parents, and they really meet families where they are and help them connect to services. One of them is embedded at the Norwalk Community Health Center, and so sees families, talks to families, helps them access services, leads them to the resource hub at City Hall, and just the other varieties of services that we have. We do have quite a good, robust early literacy programs in Norwalk. Read to Grow, which is one of our partners that's located in Brantford, provides a new book to every child in Norwalk who was born in Norwalk Hospital and in most every other birthing hospital in the state. And Reach Out and Read is another program. It's a nationwide program. It's here at the Norwalk Community Health Center. And that's where the healthcare practitioner, gives a free book to each child at a well visit. And they're really encouraging early literacy, parents reading to their children, sharing books with their children. And then we do have some little libraries that you maybe have seen around town that are located, ones at the health department. People have them in front of their homes. And we also have several of those little libraries in laundromats. We know that's a place where parents, kids are waiting. Sometimes there's not much to do. And so we're really happy to be able to provide a book for the children. And we get our books from Darien Book Aid. So we have kind of every week, a volunteer from there brings books into our office so that we can then distribute them to families here in Norwalk. And the other two really great things that we're doing that I'm really excited about, we have a group of early volunteer readers who have been trained to do really interactive read-alouds with the children. Our partners at the Norwalk Public Library have helped with that. And these volunteers, mostly retired, are based at a preschool program, and they go every week and read to the same 2 classrooms of children. And many of them started about 16 months ago. So it's a long time. We have 10, and they go into those classrooms and spend some time once a week, read to the children. And so they're really bringing more, that's just another layer of reading into the classroom, that just another person reading a book and sharing the love of reading with kids. And that's really, really important. And then just last, I'd like to finish up with we had our 4th annual Celebrate Early Childhood event earlier this month at the Sono Collection. And I am going to send this PowerPoint to Councilwoman Ayers because I'd like you to share it. We have some great pictures. We had over 500 adults and children at the community fair. We had about 22 exhibitors, including the library, the health department, Norwalk Acts, etc. And families just had a wonderful time. We had a big play area in the middle that was designed by a team from Family and Children's Agency that included a sandbox. And the kids just had a great time. And that is such a wonderful event that's held in the magnificent room at the Sono Collection. Families have a great time. They come back year after year. We give a lot of free books out, a lot of great fun things from our partners in town. And it's really just a great event. And that is all I have, Keenan. if anybody has any questions.
Thank you, Mary. I think what we'll do, if it's okay with the chair, we'll finish with our last panelist, and then if the council committee has any questions for the panelists. Our final panelist is Teresa Argandesi, who's our Assistant Director of Health, Community Health, who's just going to share a bit about as far as the different services the health department provides for our young people, our youth and children in the city.
Hello again, everyone. Thank you again for inviting us to come speak. I will focus on the child serving services, and I'm happy to come back anytime and talk about all the other wonderful things that we do at the health department. I'll try to talk fast. And so the services that we provide for kids and their families typically falls into about 3 buckets, right? So we have clinical services, we have health promotion and health education services, and then we have coalitions that we either lead or that we work on to try to tackle some of those bigger challenges that kids are facing in the city and around the state, so we can all work together to solve them. So we'll start with some of the traditional clinical or clinical-ish services. Mary mentioned the WIC program. That's the Women, Infants, and Children's program. WIC provides nutrition education, breastfeeding promotion and support, nutritious food, and I think one of the more important parts is connection to other community services. So a lot of folks in Norwalk will come to their WIC appointments, and that might be their one touchstone for assistance and for other services. Often when they're new to the community, that's how they get to know what other services are available. It's available to low-income families from prenatal all the way up to when a child turns 5. So it can help a lot through those early childhood years. And our WIC program, the last I checked, was seeing about 1,300 appointments a month. So they're really serving a big chunk of our population and providing them with great services. We also do a lot of work in lead poisoning prevention. So kids in Connecticut are by law supposed to be tested for their blood lead levels at least twice when they're littles. And if we receive word of an elevated blood lead level, our clinical staff will follow up with the family, provide some information, education. Our environmental staff, when there's a comprehensive lead investigation, will try to determine where the lead is coming from, and then remove it from, help the property manager remove it so that the child's no longer exposed to lead. So a huge part, there's no safe level of lead for a child to be exposed to, and so we're trying to assist those families during a difficult time. We also have a childhood immunization clinic that provides routine vaccinations for kids through age 18. It can be free for eligible folks. That includes also the flu vaccine in the fall, which is especially helpful for preschoolers who are required to get it before December 31st to stay in their preschool program. We have a whooping cough or pertussis cocooning program. So we offer free Tdap vaccine to those caregivers for babies, for infants who might be too young to get their own pertussis vaccination, but the folks that are spending the most time with them, family members, grandparents, people who live in the home with them, can get free vaccine from us to cocoon them in that safety. We also have a grant-funded immunization action plan program. So we have outreach workers who work with families and also with the healthcare providers and the pediatricians in our community to make sure that families have the information they need about vaccines, that providers have the information that they need, that we coordinate our approach to vaccine access, and that anyone who wants a vaccine can get it, and that the kids whose families are vaccinating them stay on schedule. We also have a sexual health clinic at the health department that is available to teens and adolescents. In looking at some of the bigger health promotion and health education programs we have the Growing Gardens Growing Health program, which is our wonderful summer program offered to families at Fodor Farm in the summer. And last year we expanded to include kids at the Learning Center at Colonial Village. And so that program is teaching kids and families about gardening, fresh fruits and vegetables, then how for families how to cook them in a way that is budget friendly and that their kids will be interested in eating, and also how to shop on a budget. Lots of really great skills, and then access to more fruits and vegetables, and herbs too. We also have Fit Kids, which teaches preschool and early elementary school kids about nutrition and physical activity and through fun, interactive lessons. We found the first graders-ish, right in that age range, are really a great target group for this program. They absolutely love it. The Immunization Action Plan program also does a fun outreach called Flu and You, where they go into preschools and teach kids about germs and how to wash their hands and keep the flu away. They use this very fun, interactive glow germ exercise where they rub a lotion on children's hands, and you can see it with a black light, and then ask them to wash their hands and see if they really were effective in getting the germs off their hands. And so again, the preschoolers really love that, and it helps teach them, one of the most important public health measures you can take is hand washing. We have another fun story time that we just launched this year called Gizmo. And so it's a mental health intervention, evidence-informed mental health intervention about Gizmo, who's a therapy dog, and he really struggles with finding what to do when he's sad or angry or worried. And so he's teaching kids about finding a trusted adult and managing your emotions. And very recently, we were able to do a story time, and I think his name is Chase, the Newark Police Department's dog, came, and we read the book. The children got a little stuffed animal puppy, and then Chase was able to come visit with them, and boy, that was a hit. If you ever need to bring a crowd of kids together, I recommend Chase come to the session, because he brings a crowd. We run the Norwalker program, which you may be familiar with, which is a neighborhood walking initiative. We have maps to show different routes that people can walk throughout the community. But we have recently also partnered with the Bike Walk Commission and others, TMP in the city, to also look at the built environment and encourage active transportation in general, so walking and biking as much as possible. And so we partner with Newark Public Schools to do walk, bike, and roll to school events throughout. I think there's usually a cluster of them in the fall, and then again in the spring. Encourage kids and the families to not drive to school and to find active ways to get there. We also do a lot of ad hoc kind of general health education. So you'll see our social media pages and a lot of outreach events where we're out at different events, at tables to give people information about any number of health topics. And then lastly, I think Mary mentioned this a little bit, David mentioned this. We also participate in a lot of coalitions. We lead some of them, including the Norwalk Food Alliance, that's looking at food insecurity and trying to promote summer meals specifically for kids in those summer months when they might not have access to, when they're losing access that they might rely on. The Norwalk Comprehensive Suicide Prevention Coalition, where we're looking at ways to take a community-wide approach, convene a lot of different partners to figure out how we can do a good job at preventing suicide and increasing mental health and well-being. We work really closely with Margaret and the Norwalk Partnership on both mental health and substance use prevention work. We've partnered with our colleagues in Stamford on the Lower Fairfield County LGBTQIA Community Health Coalition that emerged during the Mpox outbreak of a couple years ago and has continued to look at different health topics in our region that are specific to that community so that we can find ways to work together to address those. We participate in Norwalk Acts and the Newark Public Schools Wellness Committee, and some others that I know I'm forgetting. But so we try to do a little bit of both, right? Providing information, education, programs that are fun, but also educational, giving people clinical services and access to actual services that they need, but then also convening partners, looking at data, and trying to work together to try to tackle some of those larger issues that maybe just one department alone can't tackle. And so we appreciate, I'm happy to spend time another time talking in detail about any of these and probably all the 12 to 15 things I forgot. But in the meantime, thank you for your time.
Thank you, panel and Chair Ayers. I'll turn that over to you.
Oh, thank you so much. Again, we really do appreciate the panelists coming and sharing with us tonight. This is the first of many conversations we hope to be having at community service around our young people, supporting our young people, and the sustainability of the activities and the resources for our young people. But at this time, I would open up the floor to my colleagues if anyone has a question. Councilperson Ann Witherspoon.
I think I just have sort of a general, well, thank you very much, all of you, for sharing in so much detail. And again, it's what I said to Margaret. It's really, I know that these are not huge budgets that you're managing, and what the amount of services that you're able to offer is a testament to all of you and in your passion for what you do, and I'm very appreciative. And this may be a topic, Chair, that we could pick up later on. It's a broader question. I really would like to hear more about the pressure points. What the gaps are, how we can better partner with you as a council, what we can sort of do to, I'm feeling like I want to kind of understand that better, and maybe not tonight again, but to think about future conversations. Um, sort of, I was thinking as everyone was talking, like, what would you like to see happening in the next 1 to 3 years, given the, the projection of the precariousness of federal funding and different kinds of restrictions we're getting as budgets tighten up. And again, Chair Ayers, maybe this is something we can have a deeper conversation about at a future time, but I found myself just sort of thinking about that as you were all
But
talking about your programs.
yeah, I think that just looking at the time and the fairness of the panelists who've been working all day too,
Yes.
that let them take that away from us.
Yes.
And as we continue the conversation, let that be at top of the next part of the conversation. Any other questions from my colleagues? Yes, Councilperson, I'm Jessie Bucklow.
Yeah, thank you so much to all the panelists. Obviously, I work with you in different spaces, and you all doing really great work to support our children, youth, and families. I think maybe this could be part of a follow-up. There's a larger piece to this is better understanding the data about the youth that we're serving. There's a larger piece because I know that the mayor's dashboards are a little bit outdated in the information, which we can, work with the mayor's team on updating. But us as a committee, I think it'd be really helpful to better understand the number of individuals served and what that really looks like from each kind of department and space, and understanding like the trends behind that. Are things to council members, Wenestrand's point, like, are things increasing in a particular area or decreasing in another? And so I'd really like to better understand the data about the number of individuals and families served by the various programs that you all just presented on. I think that would be a really great next step too, Chair, if possible.
Okay, thank you for that. I would also ask Ms. McMahon, one person that is absent, and I don't know why, I think we both, the slip between both of our fingers. The library and the youth department of the library. I don't know why that didn't pop in the thought bubble, but as we continue the conversation, if we could just make sure, and it might have been a conflict of schedule, but as we continue, as we continue the conversation, I just want to make sure that they are a part of the conversation.
Absolutely.
Thank you so much. Any other questions? Okay. Thank you guys so much for the beginning of this discussion. I know this is kind of like, what are these crazy people asking for? But we really are sensitive to the needs of our young people. And we are very sensitive to the needs of the families. And you might hear a lot of conversation go back and forth about what we don't do, but I will always argue that we do a whole lot of stuff. And sometimes it's just letting people know what resources are available. A lot of families do not know, but I know you guys all, I've seen you in the community. I've stand with you in the community, so I do know you are doing the work. If I see no other questions, no other hands, can I have a motion to adjourn?
So moved.
Oh, thank you. A motion to adjourn. All in favor? All right, unanimously. Everyone have a good night.
Good night, everyone.
Thank
Thank
you.
you.
Good night.
Thank you.
Thank you.
Bye-bye.